Hey guys, Justin Brock here, and just wanted to preface this video by saying it was recorded at the end of a long day, but I thought it was something that maybe was necessary. I'm sorry, some of it kind of seems rambly in the beginning. I'm guilty as charged of being a rambler, but I think it's necessary to understand how I'm doing things by being able to see my screen and try to help walk you through my thought process as to how I'm quoting. And I hope you guys enjoy. Let's say I'm going to go Medicare first, and I'm going to tell you under 65 health. So with Medicare, when I get a prospect on the phone that is willing to talk to me, I am going to go in. Let's say I'm doing a turning 65 female. Okay, the first thing I'm going to do is quickly oversimplify the Medicare process, point them in the direction of the Med Sup, most likely, in the PDP sale. So what I'm going to do first is I'm going to say, okay, let's find out how much the Plan G costs, because that's what we've typically recommended at this point. So I'm going straight in and I'm finding out the Plan G. I'm looking for whether or not a company is one that I can offer. So, you can get rid of your Catholic Life and your Southern Guarantee here. And then I'm looking for ones that have one-legged discounts. One-legged meaning one person in the household signs up. Now, if I have a dual household that I'm signing up, I'm not looking for that anymore. So what I'm going to do here is I'm going to find best rate here, Everest, 85.91, female Plan G, turning 65, and 38801. I know some of you out there are jealous of that rate, but it doesn't really matter. This will work anywhere because the customers don't really know that it's cheaper in another state, most of them. So I'm going to find this. I'm going to say, okay, this is a one-legged discount. Mrs. Jones, you can get the Plan G for $85.91, but I'm not saying I necessarily recommend that one. So let's look and see what other companies are available, because there's a big factor here, and the big factor is how quickly is your rate going to go up. So then I'm going to go down and I'm going to find the cheapest A+ rated carrier. So let's say Aetna comes up as cheapest, Plan G at 97.13. Boom. Zoom in there. Boom, 97.13. Okay. So I'm going to say, listen, Mrs. Jones, you can get this rate of $85.91 on your Plan G, and that is the cheapest one. The company's called Everest. They're A+ superior rated. They've been in the market for a few years so far. They haven't had a bad increase. But the best rate with an A-rated carrier is Aetna. Okay, now they're not going to give you that discount just for having your husband live with you, so their rate's going to be $97.13. Okay, if you look at the rate increase histories, Aetna is doing pretty well. They're averaging in this market, negative 1.5% rate increase. It's a little bit skewed because of the way that's laid out. And they're averaging 0.8% on age. So it averages out to a pretty competitive increase history, judging on those market analytics. And if I look at Everest, I'm sure it's going to show pretty substantial results there, 0%, but the age-related increase is a little high there from 68 to 69. Either way, we can see that there is a competitive reason to offer both. And at this point, you could hardcore push one, but my recommendation is, instead of hardcore pushing one, let your client decide. And I can tell you most of the time they're just going to pick Aetna, especially if they're turning 65. There's always the potential later on to offer them, late, like 2-3 years down the road. Now they're wanting to rate shop. Now they're not as worried about what company it is. But in the beginning, especially if you're doing phone sales, really good to look at offering that name brand, because it's winning you some confidence right away. You don't have to convince them of the legitimacy of an off-brand company. So that would be my recommendation there. So what I would do then is I know that I said that I would tell them these rate differences. And in some cases I would, depending on the scenario. But let me show you what I would normally do. I would normally package all this together first. I would say, okay, we got the Plan G at $85.91 with Everest. We have the Plan G with Aetna at $97.13. So then I would run in here and I would say, okay, if we do them all with Aetna, I'm going to go to quote and enroll, and it's going to make me sign back in. Bada 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 bing, bada 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 boom. So I'm going to sign back in, and quickly, some people were asking, like, why do I like this cancer? Why do I like this dental? Why do I like this? A lot of this, guys, is about convenience, and I know that sounds terrible to those of you that are trying to pick 15 different products that are the best for the client all over the place. But when you can go into Aetna Quote and Enroll, and you can say, okay, I got Mrs. Jones, who just turned 65, and I don't put all this crap in there right now. I'm just pulling my quotes up. So no on the household discount, open enrollment, quote, boom, Plan G, 9713, dental, vision, and hearing. Don't even immediately, I just quote the 1500, add to cart, cancer, 20,000, quote, add to cart, I'm going over here to Medicare.gov. I'm asking her all the while on the phone. I'm filling up empty space with conversation. Doing the same thing in person. If I'm in person, it's really easy because they come to my office because I'm not going to houses. But when they come to my office, I have, really interesting family pictures and artifacts and stuff all over the walls and stuff to keep them talking. But meanwhile, I am pulling up their drug plan quote and finding out, what's going to be the best one for them on all this crap here. If I'm running a PDP, all this irrelevant. No, yes. Get past it. Yeah, I guess if you're dealing with LIS and all that, it could be relevant, but most of my cases are not LIS. If you're in the Medicare Advantage market, this video is probably not for you anyway. If you're super into the LIS market. So I'm going on here and I'm looking up the drug, Cinepril. Let's just throw in something expensive to make it spicy. Okay. Going over here, asking them what pharmacy they use. Adding a couple there. Throwing that up, pulling the drug plans only up. Okay, top of the list. Cost as of today, by the way, for those of you that don't know, includes the deductible, the premium, and all copays. So it's really pretty simple. If it comes up here and they want to do retail, it's cheaper that way. If they want to look at mail order, then we would sort it by mail order. But either way, we're going to go into SilverScript Choice. I'm going to say, okay, we got your drug plan pulled up, and I've got all of this pulled up here. So I'm saying our silver package at $198.53 plus $26.90 for the drug plan is $198.53. Whoops. $198.53. I don't know. You probably can't see my calculator. I got a calculator up. $198.53 plus $26.90 has me at $225.43. So our silver package, which is the one most of our customers choose, is $225.43. It's the $198.53 plus the $26.90 on the drug plan. And then I also will offer them the gold package. So the one thing the gold package has different is we recommend getting a home health care, adding home health care to your package. And sometimes this goofy thing messes up on me and doesn't offer it. Or you can offer recovery care. Oh my gosh. Every now and then Aetna quote and enroll disappoints me. But either way, this is the silver package. This is what I'm quoting. I'll tell like a lot of my people right now. If you're in a state where Cigna is competitive, Cigna will do the same thing. Mutual of Omaha will too. If for some reason you're not able to get the Aetna MedSup for them, or it's just so far off competitive, then you can still pull up those other places and then quote it this way. If you have an extreme aversion and want to quote the best DVH plan, then you could quote the Manhattan one, which is where you would just pull it up and have all the quotes sitting here. But meanwhile, I'm just talking to the people and I'm pulling up all these different quotes, and then I'm telling them, okay, this package together would cost this amount, $228 a month. And so once it gets into the part where they've accepted that amount and what it covers, and I haven't even really discussed coverage intently. I'd explained in the forefront what the Plan G was and what the drug coverage was so they understand the Medicare part. But I'm saying this is your Medicare supplement. This is the additional cancer coverage we recommend for additional drug cancer costs or cancer drug costs that you might run into. This includes dental, vision, and hearing, and this has your supplement drug plan. So that's our silver package. And then I tell them the price. I get them to agree to the price first. Then I would get into the details of what each plan entails. So then I would go over and I would say, okay, now on your drugs, this is going to be the best drug plan for you, but Victoza is going to cost $47 a month at Kroger, or if you go to, you said you like Thomas Street Apothecary, you can get it for $45 a month there. So then I'm telling them these little details, okay? But I've basically told them what the total cost of something was and got them to accept that first, and then I break down the details of the plans, which, yeah, you can't really do that with Medicare Advantage as much. But with this concept, you can. It's with the MedSup, PDP, you can put them on all of this stuff, and then you start going into breaking down, okay, with the dental vision and hearing, you got 60% coverage the first year, 70% the second year, 80% the third year and after. But the thing is they've already agreed to it. It becomes psychologically kind of like backwards for them to then start peeling stuff off once they've already told you, like, yeah, that sounds good, So then I would just start, I would explain those things, and then I would start taking applications. So, I mean, that's pretty simple. I know that probably doesn't reinvent the wheel for a lot of you, but for so many people that are asking me the question of how do I do it, that's pretty much it. Okay. Okay, I see a lot of chatter in the box over here, so I'm looking here. All right, and by the way, I'm going to download this whole thing and putting it as a YouTube video so people can slow it down and rewatch later on. But that's just kind of the concept, I'm looking at the packaging here. Okay. Yeah, Mike, I have compared Manhattan Life and Emeritus. I like Manhattan Life better than any other dental policy. It's just more effective. I mean, the hearing aid coverage is amazing. $1,500 hearing aid benefit for somebody after 12 months. They could use that policy and pay for the policy for 3 years with one benefit. I have the Manhattan Life on myself. I've had it pay $700 or $800 out in glasses coverage a year. The Emeritus, I don't have some of the perks on it don't really appeal to me. So I'm not a big Emeritus guy, but, and the commission sucks. Well, I guess it depends on the products. There's like a million different Emeritus products, so it's hard to say which one is which. So now I'm going to go into the under 65 market and how I would try to explain this to somebody when they first call in. When they call in and they talk, the conversation normally goes off of a question about about, hey, my wife is getting a new job. I'm self-employed. I need me and my kids coverage. She's going to be covered through the new job, but the cost is going to be really high over there. That's like one that I had today. They called it off of a Facebook ad. That was the scenario. There's several different scenarios in this. So what do you ask them to agree? Like what? I just asked them to agree to the price, Jason. Like if you can get them to agree to the price first, people are agreeing to the price. Then when you get into the details, you've got the hard part done. You've got the yes done already. So I don't know if that's backwards to the way most of you are doing it, but I'm talking about I'm saying you can get your Medicare Supplement Plan G, where you only have $185 deductible to pay each year. It's called your Part B deductible. All other eligible Medicare A and B expenses are paid after that. You can get your drug plan, which is the best one of all 24 available for you with your drug list. And then you can have the additional cancer coverage that we recommend and dental, vision, and hearing for $228 a month. So I'm saying that. They're saying, okay. Then I'm saying, okay, what questions do you have about the coverage? And I'm breaking it down. But the part that I'm talking about is what everybody else is doing is they're saying, okay, your supplement is $85.91. This is $26.90. This cancer is $70 a month. This dental, vision, hearing is so they're like, oh, okay, man, shoot, I could just have the supplement and drug plan and pay this much and just wing it on the rest of that stuff, because you haven't captured their earnings yet. You haven't captured it. And a lot of these people are coming off spending way more money. So you have to give them a price point that they're comfortable with that's higher before you tell them what is possible at a lower price. And nothing about that is misleading, because you're telling them exactly what you recommend. Every customer that comes in, I would like them to have a $20,000 lump sum cancer policy. I would like them to have dental, vision, and hearing coverage. I would like them to have a Medicare Supplement Plan G, and I would like them to have the best drug plan for their drug list. There's nothing misleading about that. I'm telling you what I recommend, and this is what the total price is. And then when they agree to that, then I can break down the details of those plans so they understand them. But you're agreeing to the price, so you're capturing that portion of their monthly revenue before they decide to put it back in their pocket by you giving them prices that are lower than that. That's what I'm doing. So let's see. So now I'm going to move on to the health side. And by the way, I've been working a lot today. So if I'm rambling and irritable sounding, I just really wanted to get this out. So I'm probably happier at other times. But okay, the healthcare side. The first thing that's going to happen when somebody calls in about the health insurance is I'm going to say, okay, your health insurance. With health insurance, you have about 5 different options. Okay, you're going to have off-exchange health insurance options that are available in your state. For instance, in Mississippi, you have Blue Cross and Blue Shield. And they don't accept subsidies for Blue Cross Blue Shield here. Okay, so you have the off-exchange ACA compliant plans, and then you're going to have your ACA plans, your subsidy-driven market, like whatever plans are on the healthcare exchange that accept subsidies. Then you're going to have your healthcare sharing ministries like Medishare, Christian Healthcare Sharing Ministries. Then you're going to have your indemnity-based healthcare plans, which are different than you're used to, but often a plan that people decide is best for them. And then you're going to have short-term major medical. That's the 5 realms. And I tell them immediately that no matter where you get this coverage, it's going to fit into one of those 5 categories. Okay? And we can show you the quotes on all 5 of those categories, so you can know which one makes the most sense for you financially, and then get into the details of what each plan entails. So first thing I'm going to always do is check their subsidy qualification. So if somebody's losing coverage somewhere else, they have an SCP, and they can get coverage through the marketplace. So I'm going to go on the marketplace. I'm going to say get answers. I'm going to say, where can I find marketplace plans and prices? See plans with personalized price estimates. Click that button, and this is basically your calculator. So I'm going to use this guy that called today, okay? Was running local Facebook ads like I've told everybody to do. 38863 was his zip code, Pontotoc County. You and other people were in the household. Now on here, if you don't know already, you're going to put everybody that's in the household, not just, the people you're trying to get covered, because they're, most likely filing taxes as a household. So this guy had 2 kids and a wife. So I'm building that out. He was 45, not eligible for any of this. He had 1 kid that was 18, did not use tobacco. His wife was 45, but she had coverage through her job. She was a parent of an 18-year-old as well, no tobacco. Dependent 1 was his 21-year-old daughter, was a full-time student. Dependent 2, 18-year-old son, full-time student. Continue. Estimated income for this guy was $115,000 a year, adjusted gross income for him and his wife combined. Guess what? No subsidy. Okay? Here's what's available to this guy on the marketplace. $1,119 for him and his healthy 2 children with a $13,100 family deductible. That's the cheapest. You go up to $1,281 a month, you can get down to $5,500 family deductible with some copays. This is also an HMO, and a lot of people here don't accept it. It's basically worse than having Medicaid here. So, first thing I'm going to do here is I'm going to tell him that. I'll write it down on my little notepad. I'm like, hey, okay, we got Ambetter at $1,119 a month. Then I'm going over here to my short-term medical quote, and I am saying, I'm saying, okay, now I'm going to quote short-term major medical. 3863. Okay, now on this one, I just have to put in his birthday. 32, I think, somewhere around there. Male, and I'm putting in his. I don't have to put his wife because she's not applying. I'm putting his daughter, putting his son, effective date, 12-month short-term medical, show plans. So the short-term major medical for this person, and these are all going to vary by state. Some states short-term medical is way more expensive, and subsidy or Obamacare plans have more options. It just depends. But here, it was a $1,000 deductible, 80/20 co-insurance, $444.19 a month for that plan. $1 million per person coverage. So I'm writing that down, and I'm telling them, okay, you got $444.19 for that plan, okay? And then I'm going to go over and I'm going to quote the Manhattan Life one. And actually, I normally just save their brochure because it's so easy to quote. Right here, I'm going to pop it up into the pricing column. And I'm going to say he's in his 40s, just him and his children. The Elite plan's $312.54 a month. Elite Plus $441.95. And I immediately tell him with this plan, we always recommend an additional $50,000 per person cancer coverage, which for him I've already ran. With Aetna, $69 a month for that plan. So I was, quoting him the Elite plan, $312 with $69. It's under $400 a month. And I hint at the perks on them too. I said, hey, with this one, you don't have expiration dates, you don't have deductibles, you don't have to re-sign up every year. However, it is an indemnity policy. So if you go somewhere and your bill is higher than the indemnity amount they've agreed to, your balance billed the rest. However, they do have the service Caris 360 where they will call and negotiate your policy or your prices down for you, which can be very beneficial. Okay. Now, the last thing I'll do is I would go to Metashare.com because we can sell Metashare as well. And I will tell them on pricing. It's just a real quick calculator. Okay, you got 3 people applying, and your birthday was somewhere around here. Submit. And I have a, in the same price range of what we're looking at short-term medical, you're looking at an $8,000 annual household portion. And that annual household portion is like a family deductible, or it's the equivalent to, so $440 a month for that. You can go, obviously go up all the way to $1,750 shared for $940 a month. Still a better option than Obamacare for him, most likely, but not as appealing maybe as a short-term medical or an indemnity plan premium. So I give somebody all those options, and then I kind of see where they're leaning. This guy actually happened to lean towards you couldn't see you couldn't see the Manhattan pricing because I'm only sharing this window. Sorry, guys. Well, either way, you can also go into here to enrollment links. Make sure you have the enrollment link added. And you can pull up self and children. This is to quote the indemnity option through Manhattan Life. And you can put in his birthday, his gender, and his state. And you can quote the different plans, Elite, Elite Plus. I just have the brochure saved on my desktop. I forgot you guys could only see my Safari window here. Okay, so $441.95 or $312.54. You can go down to these, but I don't recommend these. I mean, I really mostly only sell these. I sell these more like as a supplement to something else. So look at those, and I have all this written down, and I kind of have him taking notes on it too, so he's looking at them. This guy actually ended up being really interested in the short-term medical and adding the cancer to it. So he ended up getting his wife on the phone, and they decided to go with the National General Short-Term Major Medical and the Aetna $50,000 cancer policy. I'd sell a lot of the Manhattan Affordable Choice, but I leave it up to them as to what they decide. I kind of put out some high points of both and kind of let them, point it out or look at it. And then I send them the brochures of each one, let them overlook them. And normally I'm trying to email them while they're on the phone with me and get them to pull all that up. But, I quote the Healthcare Sharing Ministry. I quote this. I quote the short-term medical, and I'm quoting this. So I got all 4 right there. And that sounds like a lot of work, but look how fast I just did it. I got all 4 quotes, and now I'm trying to get him to pick one and go forward with it. When it gets to the point of if he's wanting to do this one, enroll now. Email address, boom. Super, super quick quoted application. And, I just put in their basic info, push on through. They're going to charge a one-time enrollment fee with short-term medical. They don't do that with the indemnity plan. That's another little benefit. That's pretty much it, guys. I mean, it's not super complicating either. I'm just, going on here and giving them all their options. And if all of their options are still not what they want, I say, well, you also have the option to try to get back on a group plan, but if that's not available to you, these are your options. So, I think a lot of people don't want to get into under 65 because it's not like MedSup where you can be like, hey, here's this plan that's perfect, or even a Medicare Advantage plan, it's not the same as that. It's not this low cost, high benefit structure because they're not on Medicare. They don't have Medicare. They haven't paid in enough to get that benefit yet. So they're having to pay for health insurance. So I'm giving them what their options are and letting them choose. And I have a lot choose Manhattan Life Affordable Choice, a lot choose short-term medical. And then I have some other people that might qualify for a big discount here. And I enroll them right through healthcare.gov in Obamacare as well. But normally when I do that, I try my best to cross-sell them dental, vision, and hearing and cancer and some other coverage, or even sometimes cross-sell them an affordable choice plan like the Classic with this plan. So there's a whole lot of opportunity there, even if somebody is Obamacare. For a long time, I couldn't even sell the Obamacare because we weren't contracted with Ambetter. I am now, but I used to not be. And so when I would sell this plan, if I didn't cross-sell them anything, I didn't make any money. So, but over time, it's paid off big time because I get tons of referrals now from all the people that I've helped, regardless of their situation. Which is, if you're struggling to sell right now, or if you're sitting there saying you're not writing enough business, then help everybody you can, even if you're not getting paid for it. And then it'll get to a point where you're like how I am now, where I kind of get frustrated during the day if I'm not getting paid for something because I actually have other people I could talk to make money. But then I just have other agents that were saying, okay, hey, help with this person. I even have downline agents that if I'm really busy, I'll refer them down to a downline, which is like a slam dunk lead for my downline. Now, if you don't have Manhattan Life and you don't have National General and you want access to those, let me know and I can get you set up with a contract because they are very, very powerful tools in the market right now. So, and it's, a lot of states. So anyway, that is my rambling for the night. I'm going to let you go. I will try to download this live video tomorrow and turn it into a quick YouTube video and share it with everybody. You guys get off Facebook and enjoy your family. Talk to you later.